Yes, you're still watching TVC Breakfast. Now, global medical advances, especially effective anti-retroviral therapy, have turned HIV from a fatal illness into a manageable condition. Now, Nigeria has recorded similar progress. A United and NAC survey shows that the country's adult HIV prevalence has dropped to about 1.4%, reflecting major improvement. Now, community-based testing and mobile outreach have enabled earlier diagnosis and increased treatment uptake, supported by strong collaboration among government agencies, partners, and health workers. With more Nigerians accessing life-saving HIV medications, the nation is seeing better health outcome, fewer complications, and a steadily declining prevalence, pointing to a more hopeful future. Now, joining us via Zoom for this very important conversation is the Director General of Nigeria's National Agency for the Control of AIDS, Dr. Temitope Ilori. Good morning, ma. How are you doing?
Good morning.
It's good to have you on the show for this very, very important conversation. Thanks for joining us once again. But I'm just going to go straight into it. In the 90s and the 80s, we saw a lot of people pass away from HIV. But as time went on, you know, we got medications and all of that, and we started seeing people live happily with HIV. Some of them marry and even give birth to children. But oftentimes, people are still complaining that these treatments that we talk about is still very difficult for people to assess these treatments. I just want to start with this question first. And then secondly, I want to speak about the fact that also, as we speak about the fact that HIV has reduced a bit, when you go to hospitals, you still see a lot of people trying to get access to these drugs. Now, we also know that HIV is not just sexually transmitted. You can get it from so many avenues. What are we doing to protect people as well? But most importantly, how are they able to access these drugs that keep them alive?
Thank you very much. Good morning, and thank you for having me. I would say that we've come a long way in the journey of HIV. The first case of HIV was first detected about 40 years ago, and a lot has been done. But I stand bold to say that we have very potent medications, very potent anti-retroviral drugs available, and they're available even here in Nigeria. We have them even in our PHC, primary healthcare facilities, our general hospitals, our teaching hospitals, across board. Across Nigeria, we have over 40,000 health facilities that are actually, providing HIV care and treatment to people across Nigeria. So I don't think at all that we have any challenge of people accessing HIV medications. We do facility-based testing as well as community-based testing. We have some partners that we work with that go to the communities, or even those in the hinterland, hard to reach areas to do the testing, and there's a mechanism to link those that are found positive to care. So I stand bold to say that we have the drugs, the potent medications available in all our facilities, and the good news is that they are even free. They are free to procure, or rather to access. So I think the major of the bane is the issue of stigma and discrimination. Many people, when they test positive, despite the counseling and despite the advice, people are still a bit afraid because of the stigma that is associated with HIV. But the good news is, one, HIV is no longer a death sentence. Like I said, we have very potent medication. In fact, if one tests positive today and you start the treatment, if by the time you test in another 6 months, the virus may not be detected in your bloodstream. That is not to say you are cured. There's no cure yet for HIV, but it can be successfully controlled. I always use the example of having an elevated blood pressure. If you go to the hospital today and they tell you that your blood pressure is high and you start medications, in another 6 months you may go again and they tell you it's well under control now, but continue using your drugs so that it remains so. It's the same thing for HIV. You test today, you are positive, you are cancelled, you are put on life-saving medications, you are compliant with those medications, and you use them as prescribed. In another 6 months, the virus will not be detected, but that is not to say you are cured, but it's to encourage you to continue to use the medications. And that's what we refer to as U equals U, undetectable equals untransmittable. And that is what we are preaching, that if you use your medications, you stay on treatment, the viral load is so suppressed that you cannot transmit it to other people. And that is what we need. And that is why we are appealing to every Nigerian to avoid stigma and discrimination so that people can actually come forward and take these free medications that are available and provided by the government.
It is heartwarming to it's heartwarming to know that the medication is still free, and we have centers spread all over Nigeria. But my concern is the education, the HIV education. It has dropped drastically, and our Gen Zs now, a good number of them, do not even understand what HIV is. Isn't that dangerous? And what about the NGOs? We used to have a plethora of them, all of them talking about HIV, going to the hinterlands and doing a fantastic job. The numbers have drastically dropped. What is NACA doing to revive this?
Thank you. It's part of why we are here today. And we've actually been up and about, and we are interacting very, very closely with the youth. For instance, during the course of this week, that's just an example. Today, we have a whole day dedicated to the youth. We have youth from across Nigeria that will be joining me. We're going to have some panel discussions and all. On Saturday, I'll be on X, the former Twitter space, discussing HIV with the youth. We work very closely with Association of Young People Living Positively with HIV, which is the patient community themselves. We have youth-friendly centers across some of our institutions here in Nigeria. We work very closely, like I said, with youths from institutions, right from the secondary schools, from the higher tertiary institutions, and we use the social media. As NACA, we have a TikTok account, we are on Facebook, we are on what do you call it now? Other, X and other social media platform, because we know the youth, they are very active and visible on this platform. We churn out prevention messages, we use music, we use drama, we use kits, and so many other things that they can relate with, and we are not doing this alone, actually. We are working with a lot of private sector entity, that have very good followership. We have influencers, that we have adopted as ambassadors on there, and they help to promote some of these messages on their platforms. We have other government agencies. For instance, we work very closely with Nigeria National Orientation Agency, NOA, and sister agencies that like that, information and all, to ensure that we amplify these messages and continue to promote the message of prevention. The good thing is that as we speak, the prevalence of HIV in Nigeria is 1.4%. And that means about over 98% of Nigerians are still negative. But you are very right, because the most vulnerable people are the youth, the young people, particularly the young women. So we need to actually be very aggressive in educating them so that they continue to remain negative, particularly now with so many risky sexual behaviors out there.
Let's talk about stigmatization, and this has always been a theme each time we talk about ailments like this. Back in the day, when people are said to contract HIV and AIDS, it's a problem, and then you see people running away from them. But more recently, we've been seeing people who are positive, who have tested positive, coming on TV saying that they are HIV positive and they are doing this, they are doing that, they are taking the drugs and they are feeling good. Do you feel that Nigerians they have gained that level of awareness, so much so that they do not treat people who carry this virus as a menace in society or as a threat to them, and then they understand that it is just there is life after contracting this HIV?
Yes, thank you. Like I said earlier, we've come a long way. Yes, many Nigerians, because of knowledge and education, many Nigerians are beginning to adopt to love and appreciate those living with HIV, to show them compassion, to show them empathy, to show them love. Because even though there is this misconception that everybody that comes down with HIV or contracts HIV is promiscuous, that is obviously not the truth, because HIV is not only contracted through sexual intercourse, but rather there are other means of contraction. In fact, the interesting thing is that some people are born with HIV. Some actually got HIV from their mothers in utero and were born, positive to HIV. Though what we, intend to do is to ensure that no child is born with HIV going forward. And I'm glad to say that the incidence is dropping. The numbers are decreasing, but we are not totally there yet. It's work in progress. So with information, people are beginning to realize that you cannot contract HIV by sharing an office with an HIV positive people. In NACA, we have many HIV positive people that we've employed into our system. We work with them in the same office, and we're still negative despite that. You cannot contract HIV by hugging people, by shaking people, So this information is spreading, and people are beginning to adopt that. And like you rightly said, that many people that they've lived with HIV for 10, 20 years, and they are living positively with it. Even some HIV positive people are married to HIV negative spouses, and they're having HIV negative children. Of course, you can't have children without having sexual interaction. But that is to show because they have been compliant with their medication, they are consistent with their medications, the viral load is so low that they cannot transmit it to their partners. What I'm trying to say is that people are beginning to adopt them, and then we have other like workplace policies, that laws and enforcement to help people that may perhaps be discriminated against. They can actually seek redress because we work with people like the Human Rights Commission and such agencies that we could actually, help us with some legal implications of some of these things.
Yeah. All right. I'm just going to churn in some questions together. But first of all, well done on what you're doing. I think it's fantastic on just educating people and making sure that there's life after, contacting HIV/AIDS. But I want to start with this. They say the stigma will kill you first before the sickness even, because when you know you have HIV, you are already worried. Am I going to die? Am I going to remain alive? And I'm happy that free drugs are being given out. But oftentimes, people do not want to go themselves and go and do the test because they are not sure is it going to be positive or negative. So a lot of people have resorted to doing the test in their houses. There are some kits that they sell now. I don't know if you know those kits. They sell it and they say it's HIV, test kit. I want you to speak to me. How accurate is that? Because a lot of people are doing that because they don't want to go to the hospital. If I go to the hospital, my face is there and it's positive, then what do I do? So that's number one. Number two as well, we're talking about our young people right now. We need them to understand, and you said it, that it's not just only through sex that you can get HIV. I know that through sharp blades and all of that, but oftentimes we are just focusing on, yes, the sex. How do we be able to educate them for them to take care of themselves when you go to the barber? Are you using their barbing machine? Are they sterilizing it? I feel like these are very important conversations.
Thank you very much. Yes, we do encourage self-test kits, and they are quite accurate. We encourage it. You can purchase them in some big pharmaceutical companies. Even we give them out free to people. We have some partners that is what they specialize in, and they donate it. They go around institutions giving it free, particularly to the young people to get tested. But after the self-test kit, even for what we call is a kind of screening kit, is a kind of screening test. You still have to come in for what we call a confirmation test. Even when we use our own screening test, we still go a step further if it's tested positive. We still have to go a step further to do the confirmation test. It's only after the confirmation test is positive, then you are cancelled and you are put on life-saving medications. So we encourage self-test kits. It's available. Interestingly, we even have a self-test kit that you can use your oral saliva. Maybe you see documentaries where it's being shown, you just swipe it around your mouth like we used to do, during the COVID era, and then you put it in a serum and it can be tested. And it's quite accurate. But like I said, we go a step further to do the confirmation, and that confirmation can only be done in the hospital, and you can only access your medications in the hospital. So you still have to come into the hospitals, but we do have some community-based centers wherein you don't have to come into the big hospitals, where you can go into the community-based centers where your privacy is more, assured. But even in the big hospitals, we keep training our health workers, not only in their clinical acumen, but also in their communication skills, in their empathy, compassion, how they relate to patients, particularly the young generation, how they adopt them and counsel them, so that they feel free, they feel they are not judged. We don't judge. And we're trying to encourage all that. So it's part of the measures we're taking.
Yeah, but let me just say this quickly. So if the person does the test in the house, because you say you encourage it and it's positive, what's the next thing? Are you going to the hospital to say, I did a test and it's positive? I just want to know the next thing. Because there are lots of young people watching as well that have done the test, it's positive, but they don't know what to do.
Please, if you do the test and it's positive, kindly go to any health facilities close to you, because you have to do a confirmation test. And when that confirmation test is positive, you'll be linked to care. You'll be told the nearest place you can go to that you can access treatment free of charge.
I am still very worried that the education on all these HIV things is not as strong as it used to be. But you have assured us that you are doing a whole lot of things, and even on Saturday you will be on social media, which I think will be quite effective. But what are the new developments or emerging therapies that are shaping the future of the HIV management and potential functional causes?
Thank you. Part of the new development is what we refer to as PrEP. These are pre-exposure prophylaxis. They come as tablets. We have those that come as tablets, oral tablets. You need to take them daily. It's just like taking HIV drugs. We recommend them particularly for very vulnerable groups, like the key population. We refer to them as the key population, people that are commercial sex workers, people that have very high risk, sexual behaviors, and multiple sexual partners and
truck
all
drivers.
So it's available for everyone. We don't discriminate, we don't judge, but like I said, we encourage the more high risk people to use this PrEP, or maybe by virtue of your work or something, and then those are oral, they're available, you can use them daily, and they are still free. They're also free, available in our centers. And then the new kid on the block now is the injectable, the lenacapavir. That can be taken once every 6 months. It's an injection taken once every 6 months. It's new in Nigeria. In fact, we're going to roll it off in the new year, 2026. We are now doing the demand creation, educating people, getting people aware of it. So the good thing about it is that it's taken once every 6 months, and it's not a vaccine, it's still a medication, and it's still a prevention medication.
Is it free?
The good old prevention measures like condoms is still very effective, and they're even more effective because not only do they prevent against HIV, they prevent against other sexually transmitted infections, they prevent against unwanted pregnancy. So we still encourage the use of condoms, and of course the ABC. Abstinence, particularly for the very young generation, abstinence is still very key. Be faithful to one partner, avoid multiple sexual partners, do not share sharp objects, do not inject drugs, because when you take drugs, then you are inhibited, and then you are more vulnerable to not negotiating safe sex. And so these are all behavioral attitudes that we still promote and we still encourage.
Yeah, so you just mentioned lenacapavir. I think there's another one, cabotegravir, which was tegravir, which is now being pushed by the WHO. But supply chains and procurement systems in low resource settings are quite fragile, and that's another challenge which this might pose, in getting to places like semi-urban Nigerian town, which could reliably stock and administer them to the people. So how long do you think, rolling out this long-standing or long-acting injectables or twice yearly treatment sound quite exciting, as you've said, but realistically, all the semi-urban area which I mentioned earlier, what are the things that we are trying to do to ensure that these people get it, store it, administer them as and when due, and what do you consider the weak links?
Thank you. CAB early, like you said, is the oral PrEP that I referred to. Lenacapavir is a new dimension. I would say is a newer model of CAB early. CAB early is an oral, lenacapavir is injectables. We're not working in isolation. We're working with donor partners. We're working with donor agencies. You are very well aware that we have primary healthcare centers in all our 774 local government area and in all our wards. So these are, we take vaccines to every local government area, to every ward in Nigeria. So having injectables, lenacapavir in every ward and every local government is not so much of a challenge. Like I said, we're not working in isolation. During the hunger, President Bill Clinton, which is Association of Chai, they help to facilitate, forcing down the price of the lenacapavir. Now is a bit more affordable, and we have some understanding with the Global Fund, with the US government and with Chai, to make it even more affordable for Nigerians. As initially, let me use that word. Of course, as a responsive government, we're going to take this forward, going forward. So all I'm trying to say is that we're not working in isolation, and we're putting everything in place to ensure that every local government, every ward, that's every center that's already offering HIV treatment have access to these new innovation medications.
All right, thank you so much. We wish you all the best with this. Well done once again on the job that you are doing, and we can only pray that a lot of people are able to get these medications. We pray that the stigma will finally leave and people can live happily with HIV/AIDS. Well done on what you're doing. Thank you so much.
Thank you.
All right, now still to come on the show, still ahead of TVC Breakfast, as security agencies